For many years, public health education was often combined with other professions. Public health is often distinguished from the clinical health profession by its focus on populations rather than individuals, public service rather than individual service, and disease prevention and health promotion rather than disease diagnosis and treatment, and its broad perspective on the determinants of disease. However, at the professional level, individuals have commonly combined the two approaches or moved from one to the other. Clinicians have always played key roles in public health. From the early years of formal public health training nearly a century ago until the 1960s and 1970s, the Master of Public Health, or MPH degree, was aimed primarily at physicians and nurses who were expected to take up leadership roles in health departments. Today, public health professionals come from much more diverse backgrounds, many entering master's programs directly after receiving a bachelor's degree. The role of clinicians in public health is also far more varied. For instance, today's pharmacists, now educated as doctors of pharmacy or PharmDs, play an increasingly important public health role in providing education about drugs for patients and practitioners and controlling prescription drug abuse. Finally, all clinicians have the right and often the responsibility to advocate for improvements in patient care and of the health system as a whole. A few clinical specialties, such as pediatrics, regard advocacy as a core responsibility of the profession. Their work has had major impacts on child health policies, ranging from the use of child car restraints, to advocacy for pediatric HIV/AIDS care, to universal coverage of childhood vaccinations, as well as the provision of comprehensive insurance coverage for children. The roles of clinicians in public health are likely to become even more varied in coming years, as public health and healthcare systems and institutions become more closely coordinated. Primary care is widely seen as the foundation of a healthcare system, and a strong primary care system is viewed as a prerequisite for maximizing the potential benefits of healthcare. Traditionally, primary care was considered the domain of physicians. Today, a range of health professionals are involved in primary as well as secondary and tertiary care. In fact, the term medical home is becoming widely used, suggesting that primary care is increasingly viewed as a team effort. Today, only about 1/3 of physicians in the United States practice primary care. Increasingly, primary care is being delivered by physician assistants, often called PAs, and nurse practitioners, or NPs, who in most states have authority to diagnose disease and prescribe medication, either under the supervision of a physician, in the case of PAs, or under a Nursing Practice Act, as in the case of NPs. Ideal primary care has been described using 6 C's: contact, comprehensive, coordinated, continuity, caring, and community. See if you can match each component with its meaning.